A Tale of Two Hygienists presents this week's TIPisode, quick and easy tips to keep you up to date and presented by the experts in the profession. Now, get ready for your unofficial TIPisode.
Welcome, everyone. My name is Dr. Joy Void-Holmes, also known to many as Dr. Joy. I am a dental hygienist with over 30 years of experience inside and outside of the operatory. I have a passion for impacting, empowering, and advancing education in the dental profession, specifically for dental hygienists. My goal today is to challenge you to think outside the box and incorporate a new product into the dental hygiene armamentarium. I'm talking about Silver Diamine Fluoride. Before I get into the why, I would like to provide some historical context on the uses of silver in dentistry. Silver fluoride was used in Japan for approximately 900 years to offer a cosmetic treatment that was also used to blacken teeth. I know some of you are probably thinking, why would someone want to purposely blacken their teeth? Well, before you pass judgment, let me explain why. It was primarily done to preserve the teeth into old age. It was used to prevent tooth decay, similar to the mechanism of modern dental sealants. It was also seen as a sign of maturity because the procedure was often performed during the adolescent period. In addition, it was also used as a sign of sexual maturity for females and was associated with beauty and civilization. Now let's fast forward. Our current understanding of silver diamine fluoride was spearheaded by research conducted between 1965 and 1969 by Dr. Nishino at Osaka University for her PhD. She wanted to combine antimicrobial properties of silver with the benefits of high doses of fluoride, which resulted in the occlusion of dental tubules through the remineralization and reduction in dental hyposensitivity. The physical ability to block dentin tubules with this new silver diamine fluoride formulation allowed it to be classified as a medical device rather than a drug, paving the way for expedited approval. In 2014, the Food and Drug Administration approved silver diamine fluoride for the treatment of dental hypersensitivity. Currently, there are 2 companies that manufacture silver diamine fluoride for dental professional use. So why would a dental hygienist want to incorporate silver diamine fluoride in their armamentarium? Rather, why should a dental hygienist incorporate silver diamine fluoride in the armamentarium? Let's examine the science. Number 1, it has silver. Silver destroys the bacterial cell, it interrupts cell division and cell wall synthesis, and can produce a zombie effect by killing pathogenic bacteria near the area of concern. Unfortunately, it is the silver that blackens the tooth. Additionally, there are more than 380 abstracts cited on PubMed on the use of silver-based products in dentistry to treat or control dental caries. Silver diamine fluoride has, you guessed it, fluoride. We already know what fluoride does, right? The fluoride concentration in all silver diamine fluoride formulations is 44,800 parts per million. That is 2 times more fluoride that's found in fluoride varnishes. Now, some of you may be asking, is this safe? Absolutely, when used according to the manufacturer's instructions for use. In the mouth, the fluoride creates fluorohydroxyapatite crystals, which is stronger or less soluble, if you will, than the hydroxyapatite. This is vital for remineralization. Fluoride is also well known for its bacteriostatic effect. Based on the science, which one of our patients could benefit from silver diamine fluoride? Our patients who are at high risk for dental caries. Patients who are behaviorally or medically challenged. You see, with silver diamine fluoride, you don't need needles or drills. Also, patients without proper access to dental care. These patients are typically at a higher risk for oral health problems, especially decay. Young children waiting for hospital-based treatments. How about non-invasive treatment for deciduous teeth that are about to exfoliate? The biggest complaint about the use of silver diamine fluoride is staining. It's important to note that whenever silver diamine fluoride is used on intact tooth structures, it will not stain. Another group of patients that could benefit from the use of silver diamine fluoride are those who are suffering from dental hypersensitivity. Now, how many times have you had a patient who could not tolerate being probed or would jump out of your chair the moment you introduced an Explorer or a curette? What if I told you you could pre-treat the area to provide sensitivity relief? What if I told you that results could last up to 2 years? Remember, Silver Diamine Fluoride was initially approved to provide sensitivity relief. The silver fluoride blocks the microscopic tubules that make up the dentin. A low solubility precipitate is formed that gives that instant relief. It is used off labels as a caries arrest and caries prevention treatment. It can also be used off-label for biofilm control. When silver fluoride is applied to a tooth, silver ions penetrate over 100 microns into sound enamel and dentin. We know that silver has those antimicrobial properties. Silver fluoride has been shown to prevent biofilm formation and has the potential for a wide range of clinical applications, from fissure protection in newly erupted teeth to managing root caries in healthy and compromised patients. I last want to touch on the paradigm shift in the profession to minimally invasive dentistry, which centers around tooth preservation and respect for the original tissues of the oral cavity. Further, in response to the COVID outbreak and recommendations from health agencies to minimize aerosol-generating procedures like the FDA, ADA, World Health Organization, and the American Academy of Pediatrics, they all recommended the use of silver diamine fluoride to arrest caries. Using silver diamine fluoride also saves time. The time required to triage teeth with silver diamine fluoride is a fraction of the time required to conventionally restore a tooth, especially as the tooth is not required to be anesthetized. 1 in 3 patients suffer from dental hypersensitivity. 1 in 4 adults suffer from untreated tooth decay. Approximately 50% of older patients suffer from root caries. Early childhood caries is still the #1 childhood disease in the world. While my math may not be exact, chances are 1 out of every 2 patients you see on a daily basis could benefit from silver diamine fluoride. This is why I advocate including silver diamine fluoride in your hygiene armamentarium. It should be within arm's reach. I thank you for spending time with me today. For more tips from me, reach out to me on Facebook, Twitter, or Instagram at Dr. Joy RDH, or visit me online at drjoyrdh.com.
We hope you enjoyed this week's TIPisode. Be sure to reach out to our guest experts and let them know how helpful their tips were. Follow A Tale of Two Hygienists on Facebook, Instagram, and head over to ataleoftwohygienist.com and subscribe to our newsletter. You can also email us at ataleoftwohygienist@gmail.com and keep listening for more awesome content from your unofficial dental hygiene podcast.